Without further ado, I'd love to welcome Dr. Yami. She is a board-certified paediatrician, certified lifestyle medicine physician, and a member and a fellow of the American Academy of Pediatrics. She is a passionate promoter of healthy lifestyles, especially the power of plant-based diets for the prevention of chronic disease. She founded VeggieFitKids.com, where she provides information on plant-based diets for children. And I'm a huge fan of her podcast, Veggie Dr. Radio, and I've been a guest on there as well. So without further ado, welcome Dr. Yami, and you should be able to share your slides now.
Hello, thank you, Rohini, and welcome everybody. Thank you so much to Rohini for inviting me, Dr. Bassam, and everybody from the Plant-Based Health Professionals UK. So here is my presentation. And I'm going to be talking about plant-based diets in children. So thank you all for coming. Today I'm going to be covering the safety, benefits, and some special considerations. So what's the issue? The issue is that, at least in the United States, we have 9.7 million Americans that are now eating a plant-based diet, but 8% of the world population consumes some sort of vegetarian, vegan diet. And I looked up the stats last week. 1.16% of people in Great Britain are vegan. And so we have all of these people, adults especially, that are eating this way, but they're wondering if it's appropriate for their children. They're concerned that maybe it's inadequate. And then we have also physicians, primary care physicians, generalists, family physicians, and pediatricians that are discouraging plant-based diets because they're afraid of nutritional deficiencies. And in addition to that, we have parents that are worried that their kids aren't eating enough in general, aren't eating enough vegetables, and so they use counterproductive strategies. And finally, size and weight bias can influence physicians and parents. So the 4 learning objectives for today's presentation is to recognize that a whole food plant-based diet is safe and beneficial for children, describe the benefits of a whole food plant-based diet for children, describe also the potential pitfalls and supplements that are required for children on plant-based diets. But finally, I also want you to know how to discuss intuitive eating principles and how that can be combined with a whole food plant-based diet in the feeding of children. So this is me and my youngest son, Desta, for Halloween. And I just want to make clear that when I am either with my own children as a mother, coaching clients, when I do my health and wellness coaching, or as a primary care pediatrician, I have 3 main goals. The first one is to promote health and well-being. I want children, I want my clients, I want them to feel good. The second one is to decrease the risk of chronic disease and promote longevity. So why not live a long and healthy life? And then third, I want to make sure that I am fostering body and eating confidence. So, it doesn't matter how healthy we are and what we're eating if we are anxious or depressed because of our body weight or size. So first of all, is it safe? So we have a mama bird here feeding her baby birds, and one of the baby birds says, "Is there a vegan option?" So I want to ask you, what do you think? Is a whole food plant-based diet dangerous for children? True or false? Obviously false, because otherwise I wouldn't be giving this presentation. So a whole food plant-based diet is not dangerous for children. And I have several quotes here from large organizations, the British Dietetic Association, that well-planned plant-based diets can support healthy living at every life and every age and life stage. And then the Academy of Nutrition and Dietetics, here based in the United States, appropriately planned vegetarian, including vegan diets, are healthy, nutritionally adequate, and provide health benefits in the prevention and treatment of certain diseases. These diets are appropriate for all stages of the life cycle, including pregnancy, lactation, infancy, childhood, adolescence, older adulthood, and for athletes. So that pretty much covers everybody. However, we have the Canadians that are on board too. Again, they say well-planned vegetarian, vegan diets with appropriate attention and all stages of fetal, infant, child, and adolescent growth. That's from 2010. And then this is from 2018, this Vegan Nutrition for Mothers and Children, Practical Tools for Healthcare Providers, actually came out of Italy. And again, a lot of the same words are used: well-planned vegan diets when based on a variety of plant foods and excluding all animal derivatives, all stages of life, including pregnancy, lactation, infancy, and childhood. Okay, so we've established that it is safe. I also want to emphasize that milk is not necessary, but also point out the fact that they kept saying that one thing over and over again, like well-planned, variety, adequate, those kinds of things. So we want to encourage and emphasize a variety of whole plant foods where possible, and pay special attention to supplementation, which I'll cover later. When it comes to growth, vegan children, plant-based children do have normal growth and development. There's been several studies that show that final adult heights are similar to omnivores. However, there was a study that came out, I think about 3 years ago, that got a lot of press, and it was studying the difference between cow's milk and non-cow milk in toddlers. But just to be aware that the non-cow milk also included goat's milk, and they followed them over time, and they found that at age 3, the children that consumed the non-cow milk were about 1.5 centimeters for the US, that's 0.6 inches shorter at age 3, but this was not final adult height. And they also pointed out that there are measurable differences in IGF-1 in the bloodstreams of children that are consuming cow's milk. They have higher IGF-1 that they are getting from the milk. So this may be affecting that height at that age. However, the question is, do we want our 3-year-olds to be on average 1.5 centimeters taller by giving them IGF-1 from cows? That's the question you need to think about. The other thing we know is when it comes to comparing plant-based children to other children, plant-based children tend to be leaner, but they're not unhealthily lean. So they do tend to be leaner than other kids. So, I asked the question, is it safe to raise children on a plant-based diet? But I also want to pose another question to you. Is it safe to raise children on a milk-based diet, drinking milk? So we know from a review study that came out at the beginning of this year, I think it was February, it was very well done, very nicely laid out, that there are a lot of risks to drinking milk, especially whenever it gets into the higher levels, which there are many toddlers that start drinking a lot of milk. So increased exposure to that IGF-1, insulin growth factor 1, like I was talking about before, increased exposure to progesterone, estrogens, other hormones, potential exposure to infectious agents in milk, especially for milk that's not pasteurized. The dairy fat increases cardiovascular disease risk, increased prostate cancer risk, increased endometrial cancer risk. 4% of little babies are going to have cow's milk protein allergy, where they're going to have bleeding in their stool, fussiness, colic, those kinds of things. Atopic disease like eczema. And compared to those that drink milk and don't drink milk, those that are consuming milk in their diet tend to have increased total mortality rates. But at the end of the day, the whole reason we've been pushing milk for decades is to build this strong bone thing, right? Well, when it comes down to it, the studies show that there is no decrease in hip fracture rate overall when they're looking at the total studies, looking at them in comparison in this review study. So really, if it's not really doing what we thought it was doing, but it's giving us all of these potential adverse effects, I would argue that it's not safe to raise our children drinking milk. So let's talk about the benefits of a whole food plant-based diet. Here's big sister talking to little brother. When mom said you should eat a lot of green stuff, I don't think she meant grasshoppers. So why whole foods in general? So we know that whole foods are foods as close to as you can find in nature in their most whole form. They have more nutrients, decreased calorie density, and no additives. But in opposition, processed foods are going to have less nutrients, increased calorie density, and often have additives like sugar, salt, fat, preservatives, and enhancers. But why plants in particular? Because as we know, we can eat whole foods that are animal products as well, but animal products or anything that's derived from an animal is missing this other stuff that's also really important. Antioxidants, vitamins and nutrients, fiber, which is my very favorite F word, and water. When it comes to disease prevention of a whole food plant-based diet, I'm sure many of you guys already know this, but I just want to reiterate. A whole food plant-based diet has been shown to have many health benefits: decreased risk of cardiovascular disease, including hypertension, coronary heart disease, stroke, diabetes type 2, digestive conditions like constipation, inflammatory bowel disease, dementia and Alzheimer's disease, and several different types of cancers. And why is that? It's because whenever you're eating a diet that is high in whole plant foods, you're going to have more polyphenols, more fiber, improved endothelial cell function, decreased TMAO production, decreased cholesterol. Similar to statin therapy, if you're eating a plant-based diet, the effect can be similar to being on a medication for cholesterol. Improved insulin sensitivity, decreased blood sugars, decreased blood pressure, both the systolic and diastolic aspects, and decreased body weight. So this is the power plate created by the Physicians Committee for Responsible Medicine, and it has the components that you want to focus on when you're eating a whole food plant-based diet. So fruits, vegetables, whole grains, beans. I would add for children, nuts and seeds as well, because we do want to make sure that they are getting sufficient calorie density in their diet. So I think that this is a great start. And then just for children, just be mindful of adding nuts, seeds, avocados, those kinds of things. Okay, so another quiz question for you. Which plant food category has the biggest bang for your buck in antioxidant potential? Is it berries, leafy greens, herbs and spices, and beans? If you've read Dr. Greger's How Not to Die, you know the answer to this question, and it is herbs and spices. They have the biggest bang for your buck in antioxidants. So where do you find antioxidants in whole plant foods? It's basically in all whole plant foods, but if you were going to put them in order of highest to lowest, then herbs and spices are gonna be the biggest bang for your buck, but also leafy greens and berries and beans are all super high in antioxidants. Antioxidants are important because they help fight acute and chronic disease. So especially in this time where we're dealing with a pandemic, we want to do everything we can to optimize our body, optimize our health, and getting as many antioxidants from food would be one of the ways to do that. Let's talk about fiber. So which plant food category has the greatest fiber content per serving? Is it vegetables, whole grains, fruit, or beans? What do you think? The answer is beans. I am a bean pusher. So remember, fiber is my favorite F word because it does so many great things. A lot of people think that fiber is just to help you go to the bathroom and stay regular, but it also helps remove toxins, excess hormones, and cholesterol. It feeds your healthy gut bacteria. We want to do that because that bacteria is doing so much for us than we actually know, and there's more and more research coming out about the gut microbiome and how important it is. But it also increases satiety. So when we're eating food that's really processed, moderately, or ultra processed, it's broken down. It doesn't have very much fiber. It usually doesn't have water in it at all. And so we just don't feel that fullness and we tend to overeat. So when we're eating diets that are rich in fiber, it helps us feel satisfied and full. And most Americans, I'm assuming probably most people in Great Britain, are fiber deficient. And this includes kids as well. So like I said, fiber, in addition to water, together, they combine to give us satiety. And when we feel satiated, we are able to regulate our appetites. It actually increases our metabolism by up to 17% to eat a whole food plant-based diet that's high in fiber. But it also gives us more insulin sensitivity. And so this is why fiber can help decrease our risk of diseases like diabetes. So how do you maximize fiber? Remember, I said I'm a bean pusher. You eat beans. So beans on average have 7 grams per serving, which is usually about a half a cup of whole beans. Vegetable Vegetables usually have about 4 grams per serving. Whole grains range from 2 to 4 grams per serving, and fruit 2 to 3 grams per serving. So as you can see, all whole plant foods have fiber. So the more whole plant foods we eat, the better. But if you really want to maximize that fiber, you want to go for the beans. Really quickly, I just want to point out that all the macronutrients are found in whole plant foods. And so we're kind of in an age where we like to demonize macronutrients, whether it's carbs or fat or whatever, but they're all important to us. So remember that whole plant foods have carbohydrates, they have protein, they have fat, but it's attached to fiber. And you know, we get concerned, a lot of people get concerned about this protein thing. It's not a concern for me. I'm not even really going to address it very much in this talk, but protein is present in all whole plant foods, and it is different percentages. So it's in varying degrees, but it's all there. So as long as you are eating sufficient calories, you're getting enough protein, but you can eat the carbohydrates, you can eat the fat, it all has fiber in it. And so we benefit from all those macronutrients. So how do you prescribe a whole food plant-based diet? Well, I like to emphasize what to put in rather than what to take out. I tell my patients, just eat more whole plant foods. Put it in every single one of your meals and snacks. Get your fruits, your vegetables, your whole grains, your beans, your nuts and seeds. And try to get to at least 75% of your meals with whole plant foods in it. But it doesn't have to be all or nothing. There's definitely different personality types when it comes to habit and behavior change and diet in general. So I think that starting here for a lot of families is just more realistic and reasonable for them. Okay, so let's talk about special considerations. So here we have 2 poor vegetarian children who, in lieu of wishbones, they use a slab of tofu to make their wishes. And I love their little shirts with the unicorn and the rainbows. So true or false? Protein deficiency is very common among vegan children. Hopefully you know the answer to this since I kind of already said the answer. So false, not common. So like I said, when it comes to calories and protein, the main thing is that you want to get enough calories. And if you're getting enough calories, you're getting enough protein. However, you know, definitely children, and I have a lot of plant-based and vegan children in my practice, they don't have a problem. But where you can run into problems is in your really little ones. So the young toddlers are supposed to run and play. They don't want to sit and eat very long, which is fine. But if you're only offering them raw fruits and veggies that are low in calorie density, then it might be too much roughage and not quite enough calories. But you just have to make sure that you are following along with your pediatrician, the growth curves, make sure that they're doing well. I just point this out because it's a possibility. I don't see it happening very often. But in these cases that get media attention where, you know, there's vegan children or quote vegan children that die, they're not eating a diet that gives them adequate calories. Like the ones that I've heard of, they're just being fed juice, completely raw food diets, and probably not consuming enough. Whenever you have a very little tummy and very little attention to wanting to eat large volumes of food, which toddlers are not going to do, you have to make sure that you're getting the beans and the nut butters and the avocado and those kinds of things in there, and then following the growth curve along with a health professional. Okay, calcium is another one that people get concerned about. There is plenty of calcium that can be found in whole plant foods, particularly in beans, greens, and fortified foods like calcium set tofu, fortified orange juice, and plant milks. Rohini told me at the beginning, before we got on, that in the UK, there's not as many fortified foods available, maybe more and more something that might be available. But that is something that we have available in the US. And then low oxalate greens that don't bind the calcium are the ones that you want to focus on if you want to increase calcium intake. So there's going to be like kale, bok choy, collards, Chinese cabbage. Iron, again, you find it, your beans, greens, and your fortified foods. Absorption of iron increases whenever you consume it with a source of vitamin C. And a lot of plant foods have vitamin C in it. So I don't get too concerned about that, but that's just one thing to be mindful of. And again, fiber, phytates, and tannins may inhibit absorption of iron. So one of the things that you can do, which I'll address later as well, is soak beans and grains beforehand to decrease the phytates. Tannins are found in teas, so I don't generally recommend that little children be drinking tea, especially caffeinated tea. But if you are drinking that with a meal, it can inhibit the absorption of iron. And then protein, like I said, you're going to get enough as long as you're getting plenty of calories. And then when it comes to bone mineral density, like I addressed before, we have been depending on cow's milk and dairy and all of this. But when we form strong bones, it's not just from what we eat. It's also because we're doing weight-bearing exercise. So it's important to know that bone mineral density is formed from weight-bearing exercise in light of adequate calcium, adequate vitamin D, adequate B12, and low sodium intake. And other things that are in adults can decrease calcium absorption, but for children, I would say that the sodium is one of the main ones to look at. Okay, so let's talk about supplements. All children that are eating a completely or predominantly plant-based diet should be taking a B12. Vitamin D is something that a lot of people should be considering. And then omega-3 DHA, EPA may be important. And then other ones to consider are zinc and iodine. So vitamin B12 is actually produced by bacteria. And it's one of those things that we are not consuming as much because we have changed the way we eat, the way we grow food. And it's present in animal muscle, but only because these animals have been eating the bacteria. So in modern days, factory farmed animals, they actually have to be supplemented with B12 themselves because they're not eating a diet that they used to, their usual diet. They're being fed a different diet. So they have to be given B12 vitamins. So like I said, those on a predominantly or completely plant-based diet should be taking the B12. It's cheap and it's easy and it can prevent potential complications. These are the RDAs in the USA, but what I say for my patients is if you're going to take a B12 supplement by itself, then get one that's at least 50 micrograms per day, or you can do 2,000 micrograms 1 to 2 times per week, something like that. I tend to go based more on like a daily supplement rather than several times a week, just because habits are easier that way, but you can talk to families about what they would rather do. Vitamin D is produced in the skin from sun exposure. There are a few foods that may have vitamin D in them, but there's few natural food sources. And many people are not getting enough vitamin D because of our modern culture. We're indoors, we wear protective clothing, we're wearing sunblock, and then people with darker skin tones, they need more sunlight to produce the same amount of vitamin D, so they're at greater risk. In the US, breastfed babies are automatically supplemented with 400 to 600 international units per day. And for my patients, after they turn age 1, whether they are breastfed or not, I supplement everybody with 600 IUs per day. In the UK, or up to 1,000. It kind of ranges depending on, child to adult. And in the UK, that's 15 to 25 micrograms. And I think what I saw in the recommendation from the handouts is the current recommendations there are 8.5 to 10 micrograms per day. So a little bit different. Here in the US, there are also fortified foods that have vitamin D in them, but one of the big ones is cow's milk, and I would prefer people not drink cow's milk to get vitamin D. Vitamin D is not something that is naturally present in high amounts in any mammalian milk. That's why breastfed babies are supplemented with vitamin D. So the cow's milk is the same. That's something that's added to the cow's milk. It's not naturally there. So omega-3 DHA EPA is actually produced by microalgae. So we tend to think of omega-3 coming from fish fat, but fish eat the microalgae and then it gets stored in their fat. So there are vegan algal oil supplements, thank goodness. So we can cut out the fish and go straight to the supplements if we need them. There are several forms of omega-3 fatty acids. There's the ALA form that we can easily get from walnuts and flax seeds and hemp seeds and chia seeds. And we may be converting a small percentage over to EPA and DHA, but there may be some genetic differences or other factors that may affect how much we're converting over. Currently, supplementation is recommended in pregnancy, 300 milligrams per day. There are currently no formal recommendations for children, but what I've been telling my plant-based families is to consider supplementing. For those that aren't plant-based, they may be getting EPA and DHA from eating some fatty fish, preferably ones that are low in mercury, but obviously you can bypass the fish, like I said before, and go straight for the supplement. But like I said, no formal recommendations, and this is just something that I'm talking to my families about considering. And I think that the benefits probably outweigh the risks, and I'm waiting for more research and data on that one. So zinc and iodine are two other ones, and Rohini was telling me that in the UK, iodine especially is very important. Zinc is found in grains, beans, nuts, and seeds. Just like iron, vitamin C improves zinc absorption. And this is, I would say, one of those things that can be most important to consider in children that may have nut allergies, nut and seed allergies, maybe avoiding, there's some families that might be avoiding certain things. So you may need to pay attention to it in those cases. But in general, I don't worry about zinc deficiencies unless there's something like a child that has a very restricted diet for whatever reason. Just like I said with the iron, if you soak grains and beans, you're going to reduce that phytate content, so it increases the absorption of zinc. Iodine is one that here in the United States, iodized salt is more common, but when it comes to families that are more health conscious or really like to cook and get into the fancy salts, all of these Himalayan salts and these fancy cooking salts, they don't have iodine in them. So I usually recommend getting it via a supplement or seaweed, but those on formula or breast milk don't need to be supplemented until they're off. And babies, they're breastfed babies, they are getting iodine through the breast milk as well. Okay, so let's talk about intuitive eating and health at every size. So here's two moms chatting, and one mom says, "My daughter is a modern baby. She doesn't cry when she's hungry. She texts me." All right, so what do you guys think? Is it true or false that most parents of children ages 1 through 5 consider their child picky? True or false? This is very true. The majority of children are going to describe their child as picky at this age. So what is intuitive eating? I like to simplify it. For those of you that want to know more about intuitive eating and all of the principles, there's the reference is going to be at the end of the slides. It was created by two ladies, Evelyn Tribole and Elise Resch, but I like to simplify it for children about being mindful of hunger and satiety. So children are born with this ability to tell when they're hungry and when they're full. When we practice intuitive eating, especially when we foster this and support this in our children and we continue it as adults, it has so many benefits. So we know that people that eat more intuitively, they have greater insulin sensitivity, glucose regulation, health markers, including cholesterol. They have better digestion because they're not overeating, they're not skipping meals, doing those kinds of things, stable weight. And one of the most important things, at least for me, is that they just gain more pleasure from their eating experience. So children, they are competent eaters, otherwise known as intuitive eaters. They display cues when they are hungry and they are full. And they, over time, they can maintain this. However, when their food intake changes, which is usually around toddlerhood, and their growth rate decreases, they're decelerating in their growth rate, they're going to be eating a little bit less. And parents get really stressed out at this time, and parents start encouraging their child to eat more, just one more bite, or, chasing them around, here, one more bite. And the kid's like trying to play and do all this stuff. And so that's when parents start to interfere with this natural ability to sense hunger and fullness. So force feeding actually decreases the variety of fruits and vegetables that children will try. But At the same time, food restriction for those parents that may be afraid that their child is eating too much actually increases food-seeking behaviors. So we're doing things that actually create the opposite reaction that we intend to create. So 85% of parents try to get their kids to eat more food, just like this. So you see this little guy, he wants to play. He's like, I'm done. Look at this huge meal that this mom is trying to feed this kid, which is also unrealistic, but we have kind of portion distortion when it comes to children. And he has obvious cues. He's like, no, I'm full. I just want to play. And she's like, here comes the airplane, trying to get him to eat more. And this is really common. I used to do it. Our parents did it. We all learn how to do this. One of the things that I also like to tell parents is that taste preferences develop from persistent and repeated exposures. Everything that we learn to like to eat, no matter what it is, we learn to like it. It's not something that we're born with. The only thing that you might argue that we're born with liking is breast milk, because otherwise, it's a bad deal. We need that to survive. But besides that, we have to learn how to like all the foods that we learn to like. And that's why we can have kids born in all kinds of parts of the world and they eat the food of their culture. The authoritative feeding style is one of the ones that's going to have most success when it comes to raising kids that will accept a wide variety of foods without stress at the dinner table. So what does that mean? Respect hunger and satiety. Do not force eating past fullness or even eating certain foods. I know that might be kind of controversial to hear, but also not restricting food. And what I mean by this is restricting access to calories when a child says that they're hungry, or overly restricting foods, which I'll talk about in a little bit. Also not rewarding with foods. I know it's so easy to reward with food. I run into that a lot at my office that, kids get a shot and the parents are like, okay, let's go get ice cream. Remember, I promised you that ice cream. I usually don't say anything, but it is one of those things that we start to develop that association. I have a negative mood or a negative experience and I'm going to go for food. And that's one of those habits that can be really difficult to change when you're an adult. But something that you do want to do is create structure around meal times and offer health promoting foods. So this structure is loving limits. So I said earlier, you don't want to be chasing your toddler around the house with food, but you do want to have your breakfast, lunch, dinner, a couple of snacks, have a flexible schedule, sit down in an organized fashion, either in their high chair, on your lap, you present the food, and then they decide if and how much they want to eat. And in fact, that's one of the skills that I try to encourage parents to learn. It's called the Division of Responsibilities by Ellen Satter. And this gives autonomy to both the parent and the child to have certain roles. So the parent's job is to decide what, when, and where the child is going to eat. So you're the one that's going to be preparing the food, getting it ready, sitting down, having the child sit down at the table. Then the child has complete autonomy to decide if they're even going to eat any of that food, and if so, how much. They may not touch the broccoli today. They may eat all of the bread today. So your job is going to be to step back, take a deep breath, and try not to interfere. Easier said than done. Even I'm not perfect at this, and I wrote a book on it. I also want to address health at every size. And health at every size has been very misinterpreted, and it's just created a lot of polarized feelings. People get really uptight about this one. And this is my definition of health at every size. The potential that a person has to improve their health, well-being, and joy through habits and behaviors, regardless of weight or body size. Okay, so the potential that they have, and then health, well-being, and joy, habits and behaviors, regardless of weight or body size. Health at every size does not mean that every single person at every size is healthy. Because we know that not every lean person is healthy. We know that not every larger person is healthy, but there are larger people that are doing exactly this. They have well-being, they have joy, and they can be a larger bodied person and have these habits and behaviors. So this is why I defined it this way, to help people understand what the difference is between what's being promoted in the media or how it's being misinterpreted. So it has 3 tenets to it. The first one is compassionate self-care, and that includes intuitive eating. So Health at Every Size does encourage people to pay attention to their bodies. Eat when you're hungry, stop when you're satisfied, pay attention to how food makes you feel, but also move joyfully, move in a way that makes you feel good and not for weight loss or, those kinds of end results. Also respect. So respecting the fact that we are from different cultures and ethnic backgrounds. There's going to be body diversity. There's going to be natural human differences. And finally, critical awareness. So challenging cultural assumptions. We have a thin ideal here in the United States, and value lived experiences, knowing that everybody has their own life journey. When it comes to children, body size in children, parents do get very anxious about the size of their child's body. I feel like there is a magic number when it comes to percentile. So it's one of those things that I have to approach very carefully when I talk to families about their child. But the most important thing is to follow growth trends over time. Is the child staying on that curve? Does their body size make sense for their genes, for their parents, for their family? Of course, there's going to be serious genetic and metabolic conditions or feeding issues or whatever that we have to pay attention to. That can happen. It's real world, but most of the time that's rare. Like I said, take into account family body types, whether the people in the family are naturally tall, larger bodied people or petite people. That has an effect. And finally, emphasize habits and behaviors rather than weight and size. So what are they eating? How are they eating? Is it chaotic? Is everybody eating in front of the TV? Are they moving together as a family? Are they getting sufficient sleep? Or are the kids all stressed out? All of these different lifestyle habits influence our eating and influence how our body metabolizes. So it's really important to pay attention to that rather than focusing on, oh, your child is too big. That doesn't help the family anyway, and it's stigmatizing and it can lead to other problems. So emphasize habits and behaviors rather than weight and size. And the reason I care about this so much is because weight bias in medicine is a real thing. So at least 1/3 of women have avoided healthcare because of their weight. That means they flat out haven't gone when they think they should go. And healthcare providers can be biased in both directions. So you see a larger bodied person and you assume that that person automatically has diseases or has, heart disease or whatever, but you may see a lean person and not even think that, oh, well, this person might have cancer or might have heart disease because we've been biased to think in different ways. Also, shaming does not support patients in making more health promoting choices. I know that that's a habit that we have in the culture, is shame people by making them feel bad about their weight. It doesn't help them. So I would not condone that habit. And dieting, and by dieting, I mean purposely restricting calories, is often harmful and counterproductive. So like I said, emphasize habits and behaviors rather than weight or body size. And then really quickly, I just wanted to address this. There was a study that they did in 2017 that found that vegans have significantly less disordered eating behaviors compared to omnivores. They compared 2 groups because a lot of people assume that people are being vegan because they have an eating disorder, but in fact, that's not true. However, if you do have a patient that is wishing to transition to a plant-based diet, just talk to them about it. Examine why. Talk to them about their body image, their body dissatisfaction, if they have it, and if they think that eating this way is going to make them thinner or leaner, or if they're doing it because they have an ethical concern or environmental concern. Teenagers is one of the fastest growing populations of people eating a plant-based diet, and it's usually because of environmental or ethical reasons. And then just help them. Make sure that they're not just eating French fries and Diet Coke, help them get some variety, and it doesn't have to be difficult. But also for families that it's initiated by the adults, flexibility is the key, especially for the older children, and having a little bit of wiggle room in there for the kids that, for social reasons or other reasons may choose to eat something different. And that's something that every family has to address themselves. So in summary, plant-based diets are safe and health promoting for children. They provide many health benefits. There are some special considerations when feeding children. You got to think about supplementing vitamin B12, vitamin D, omega-3, DHA, EPA, zinc, and iodine. And also consider feeding style and emphasis on habits and behaviors rather than weight to support health promoting eating habits. So like I said, these resources will be available to you on the slides. How Not to Die, Fiber Fuel, the Intuitive Eating book. So there's lots of great stuff there. I also have a book, A Parent's Guide to Intuitive Eating, How to Raise Kids Who Love to Eat Healthy, where I go into more detail on all these things. Lots of great social media resources. And then finally, just do the best you can. Show compassion to yourself and others, and be joyful. All right.
Thank you so much, Dr. Yami. That was absolutely incredible. I feel like you covered all the questions that I had, and lots of other people had watching that. And I know that for anyone who's listening and wants to know more, your podcast is such a wealth of information on this, and your book, A Parent's Guide to Intuitive Eating, and it's available on Amazon in the UK, and it's really, really great for anyone who wants to just delve a bit deeper into the topic of how to eat intuitively as a family.
Thank you.
So I think we'll just dive straight into the questions. And one of the ones which doesn't relate to nutrition specifically, but it's one that as a mum yourself and working as a pediatrician, that you might have some advice to share, is what advice would you give to parents trying to navigate social situations like birthday parties, sleepovers, even school, outings and things like that? What would you suggest to parents in that situation?
Yes, so I kind of was hinting at this a little bit earlier, and I think that this is going to be something that each family has to decide for themselves what's right for them. I think the main thing I want families to know is that there's no right or wrong. However, certain ways that you would approach it could have some consequences, right? Mm-hmm. So if you're going to choose to tell your child you can never have anything not vegan anywhere you go, for some children that can be socially isolating, and different personality types, they may actually start sneaking that food. So you just have to be careful. There are some children that themselves, they're like, no, I'm never going to eat that food because I feel very strongly about this for whatever reason, ethical health, whatever reason. But there's some children that you need to let them explore on their own. So what we do at my house is, at home, we're 100% plant-based, as health promoting as possible, as many whole foods as possible. But when it comes to school events and social events, I tell my children that they can choose what they want. So, it may be a cupcake every once in a while, maybe some ice cream, every once in a while, cheese pizza. Now, does that make me super happy? Like, no, I'm going to be honest. I'd rather them not eat that. But I think it's going to help them navigate the world better, instead of me being like over them, like, you can never eat any of that stuff ever, So each family has to decide, but I would recommend that you be consistent and, just tweak it over time for what works. Like when my kids were younger, I was able to control things and send stuff to parties and send stuff to classrooms. But now that they're older, I'm like, you know what? I don't have time for that. And if they ask me, like, I want something special, I'll go get their vegan treat and send it with them. But there's like a birthday party, like every day, it seems like, in school. So it just becomes a little bit more complicated.
No, that makes total sense. And I think that's really great advice. What about fat in the diet? I know that this is one that is quite divisive amongst sort of plant-based health professionals in general, about, how much fat do we need? I know that for adults, we recommend often to prevent cardiovascular disease risk a lower fat diet. But particularly for people, with heart disease, but what is the optimum amount of fat in the diet for children, and what do you suggest those sources are of fat in the diet?
So I don't think we need to micromanage fat, and I don't like to say you have to have a certain amount. The thing that's important about fat is that fat is calorie dense. So whenever you have toddlers and small children that especially don't eat very much, their volume is small, that helps them get enough calories. And so it really helps kind of round out the diet. And it doesn't have to be in large amounts, but I wouldn't purposely exclude it. That's one thing that I just say, don't put your child on an ultra low fat vegan diet that doesn't have any nut butters or avocado or any of those things. I don't think you have to use oils, but if you have some whole plant food fats in there, then that's going to ensure that your child is getting sufficient calories and, getting a well-rounded plant-based diet.
That's great to know. And I suppose for children with very small appetites, then a little bit of hemp seed oil and things like that would be good to drizzle on if they've got a very small appetite.
Exactly. And then I start integrating that in special cases, like athletes that are just like burning a ton of calories and they just cannot tolerate any more volume. They're just like, please, I'm tired of eating all the time. Then, I'll use oils and stuff like that. But for the most part, I don't think you have to use it if you want to avoid it, as long as you are putting some of those whole forms in.
Wonderful. And how do you recommend dealing with healthcare professionals who might be resistant to the idea of plant-based diet? We know that the British Dietetics Association and the American Academy of Dietetics, they're all in support of plant-based diets, but we still see resistance from so many corners. What would you say if someone's got a GP or a doctor who isn't supportive?
Well, I would say to have empathy for them, knowing that they do care about you. And, just because I was one of those people once, so I know exactly what it feels like. I don't want to be a hypocrite and be like, that's just what we were trained. So have empathy and, send them some love. But if you feel that you're not supported by your provider, then seek somebody out, whether it's online or somewhere else. I do think it's important to continue to see a doctor. That's why I just hesitate. Some of these cases where these babies have died, they were not seeing doctors. I mean, there's no doctor that would have let something like that happen. You just want to make sure that children are following their growth curves, all of those things, and then find somebody who is supportive. And then, I have had some families have success with giving their doctor information, like gently, just know how to approach it, because doctors also, we tend to be kind of prideful and, we hate feeling like we don't know something. So whenever you approach your doctor, do it in a very humble way, like you're just being helpful, and this will be less likely to cause this like, just drink the milk, okay? Or your kid's gonna die, like you just want to do it in a gentle way. But I have had some families that have been successful and actually converted their doctor over to a plant-based diet. So it is possible.
That's incredible. So one of the questions that I thought was quite interesting, and I have some thoughts on it, is from Marissa, who says, can children ever eat too much tofu? My 6-year-old daughter, vegan from birth, loves all forms of tofu, fried in miso soup, scrambled, smoked, and has it several times a week. What are your thoughts on this?
I think several times a week is fine. I think if we're doing it several times a day, there could be a concern, and this is like buried in my head super deep, which is one of those really rare, crazy things. But they did do a study several years ago that found that people in general, but children, this is more common in children, that consumed a lot of soy had increased risk of Kawasaki disease. So who knows what the, correlation does not necessarily equal causation, but several times a week is fine. I just wouldn't overdo it every single day.
Just to say, I think like a lot of soy, I guess that would be sort of 5 or 6 portions, but having about 2 portions, like a cup of fortified soy milk and some tofu or tempeh, sticking to the more minimally processed or less processed sources like edamame and tofu and things, that's very beneficial. It's just, I suppose, when it displaces all the other good things in the diet.
Exactly. You want to displace other stuff. And like you said, that was the other thing that I tell, is to stick with the whole forms: tofu, tempeh, edamame, soy milk, unsweetened preferably, rather than the isolated soy protein.
So that brings me on to sort of, what are your thoughts then on meat substitutes, and where do they fit into a child's diet? Because that's something that a lot of children might find it easier, I suppose, to fit in with birthday parties.
Yeah. So exactly. So I think for those situations, they work great. And I think that every once in a while they're fine. I just wouldn't make that the foundation of the diet. I really emphasize that whole part. The whole part is one of the most important parts of this diet, you know? So yeah, birthday parties, school lunches, if you feel like your child needs to have that transition to use maybe some of the alternative lunch meats that are, you know, plant-based, some of those things, I think it's fine. I just wouldn't make that the foundation.
Sure. And what are your thoughts on, what are the initial tips that you would give to someone looking to transition their family to a whole foods, plant-based way of eating? That's a question for someone.
Yeah, I think that knowing how this goes from a personal way and from clients that I've worked with, emphasize what you're going to add to the diet rather than what you're taking out, because especially significant others tend to get really anxious when you say you're removing all the animal products. So just be careful about that. And then, you know, depending on the personality types of your children and your significant other, then the slow and steady, little bit at a time, might work better than kind of the all at once sort of thing. And, you know, just call food what it is. Instead of saying this is a vegan, you know, risotto, I'm making a mushroom and butternut squash risotto. You know, you emphasize what's in meals rather than out of it. And it's so easy to just take your common meals that you eat, which really we only eat about 8 meals in general in each family. Just take those and make them plant-based, or slowly ease them into plant-based. Instead of doing all meat for your, you know, spaghetti bolognese, do half lentils and half meat, and slowly over time make it so that it's just a lentil, you know, bolognese sauce, you know, like things like that. It's so easy to do. And really at the beginning, you don't even have to tell anybody. Like nobody has to know, especially if you're the one that cooks, you know, you're just like, hey, I'm making amazing food now, guys. And everybody's going to be so happy.
Yeah, I think that's a great approach, and kind of, like we said, kind of transitioning over time rather than kind of overnight is definitely easier for the whole family. And there are some sort of comments in the Q&A box which I think people talk about quite a bit. And is there a lack of studies on children that are raised on a plant-based diet? And do you have any thoughts about that? And the specific question was, are there any studies showing the impact of a plant-based diet on cognitive outcomes for vegan children?
Yeah, so yeah, I don't think that there are a ton of studies specifically looking at this. In fact, I don't know any specifically just looking at children and, you know, cognitive outcomes that I know off the top of my head. But I just don't think that this is a concern. You know, it's one of those things that whenever we're eating meat or we're eating animal products, a lot of the nutrients that are concentrated in those sources we can get from plants, because those animals got it from plants too. We just have to pay attention to making sure that we're including those things in the diet, which isn't as hard as people think. I will just tell you anecdotally, which a lot of people don't like to hear anecdotal things, but I'll just tell you anecdotally from my practice, where I have a lot of children that are being raised fully or predominantly plant-based. These kids are doing great. They're smart. They're growing great. Some are just like huge kids, you know, like super tall and doing wonderful. So it's not a concern. Should we have more studies? Yeah. And I think that that's something that we can work on over time, but I don't think that it should prohibit anybody from not raising their child this way if that's a desire that they have.
Definitely, and we do have enough studies to show that vegan children are healthy, they're growing at a healthy rate, and on all of those things. And with regards to omega-3, you mentioned that, you know, some people might want to consider taking a supplement. And what is the ratio of DHA to EPA that you recommend for growing children?
So I just tell families to look for one that has about 150 milligrams of each, about. This is one area where the Schurzeyes, that they did the Alzheimer's solution, they're actually releasing a review study on DHA EPA and children's brains. So I'm super excited about this. It's been sent to the editor, and so hopefully we'll be able to see that soon. And I'm going to have them on my podcast again to talk about DHA EPA. So we should have more information on that soon. But right now I'm saying about 150 milligrams.
Perfect. I think just one last question then, and then I'm just going to launch the poll to get everyone's feedback as well and share the fact sheets that we have. But what are your thoughts on infant, sort of baby-led weaning from the age of about 6 months, and what would you recommend parents focus on?
Okay, so I love baby-led weaning. However, I think that only doing baby-led weaning, we could be potentially missing out on some opportunities, because children, depending on their developmental readiness, they may not be ready to feed themselves yet. And between 5 and 7 months, we have this narrow window of opportunity where children are particularly receptive to bitter flavors. So this is like the great time to start exposing your child to kale and broccoli and Brussels sprouts and all of that stuff. And so if they're not feeding themselves yet, you're missing that opportunity. So that's when I say that's a good time for purees. But as soon as they're ready, they're grabbing the spoon, they're grabbing everything, then do baby-led weaning and just give them the stuff appropriately cooked, soft, and those kinds of things for them to be able to feed themselves, because that definitely supports intuitive eating. When we're constantly feeding our children, we may be overriding that a little bit. We always want to give that extra little bite, but when they're feeding themselves, it helps support the intuitive eating. But you may miss out on that brain window time when they can start accepting flavors.
And I think you go into more detail about this in your book as well in a couple of places. So I'm just going to launch the poll now and also share so everyone can just vote quickly. But I also want to share the fact sheets that we have on Plant-Based Health Professionals UK website. Can everybody see? Can you see this, Dr. Yami?
Yes, yes.
Yeah. So we have lots of free fact sheets, including tofu, how to introduce peanuts to your baby, and these are all worked on by Dr. Miriam Martinez-Biaggi, who's a paediatrician based between London and Spain, and she's absolutely fantastic. So she's on our board and has been helping us. And there's these fact sheets that are for everyone's use, really. So you can download it if you're a healthcare professional or you're just a mum and you want to know a little bit more. And this is the fact sheet that the British Dietetic Association has endorsed, and it was produced in conjunction with Alpro. This is for healthcare professionals, and we're going to be uploading it to the PBHP site soon as well. So keep your eyes peeled for that. Next, in 2 weeks' time, we're going to have Dr. Hannah Short for this webinar, which is about premenstrual disorders, which does not get enough attention at all, just like many other areas of women's health. And if you enjoyed this webinar, then definitely consider donating, because all the funds go towards supporting these webinars and our other work to promote whole foods plant-based nutrition. And membership is open to everyone. If you want to see the recording of this webinar with Dr. Yami, as well as our previous webinars, then you can just sign up on our website. And it's, as I mentioned, it's open to everyone, and it's much cheaper if you're not a healthcare professional as well. So definitely go and check out our site. I'm just going to stop the share. Dr. Yami, some people were asking as well about if you could just mention the resources again on the last 2 slides, just to share that. A lot of people missed that, so they just wanted to know where they can find you on social media and your website.
Okay, well, a lot of these are listed on my website too. VeggieFitKids.com, under the resources section, you can find all of these things. But as far as the books, I put How Not to Diet by Michael Greger, Fiber Fueled by Dr. Will Bolsowich, and then the Intuitive Eating book by Evelyn Triboli and Elise Resch, and Health at Every Size by Linda Bacon. And my book is A Parent's Guide to Intuitive Eating, How to Raise Kids Who Love to Eat Healthy. And you can find me on Instagram, Facebook at the Dr. Yami, all spelled out. And I'm pretty active on there. So I'm happy to be of service.
Thank you so much. Yeah, I can't recommend following Dr. Yami enough. She shares really delicious recipes, lots of nutrition tips, really joyful, happy, just reflections on plant-based living. And I just, love you on social media and your podcast, because you have such interesting guests from so many different backgrounds and so many different healthcare professionals as well. So thank you for joining us all the way from Washington, really bright and early your time. It's quite late here, but thank you for being our guest tonight and putting so much love into the presentation and so sharing all your amazing expertise with us.
Thank you so much. It was an honor.
And we'll be in touch soon, everyone. Join us for the next webinar in 2 weeks.